I am Dr. Robin Gupta, consultant endovascular and stroke interventionist at People Tree Hospital. Today I will be talking about brain attacks, that is stroke. Stroke is when there is a sudden occlusion of blood flow to the brain. It causes death of a part of a brain. It is also called as, in simple language, brain attack. What are the symptoms of stroke? In simple, we can remember is B fast, which stands for B, E and fast. So B is for balance, whenever there is any sudden onset imbalance, or E is for eye, sudden onset, any patient develops blurring of vision, loss of vision, or suddenly develops double vision. Fast, that is F for face, A is for arms, sudden onset if there is any facial deviation or any weakness in the arms or legs. S is for speech, any speech sudden onset disturbance. Then remember, T is for time. That is the time when you have to rush to the hospital. Stroke is an emergency. Every second wasted, there are 30,000 neurons which dies in every second we delay for the patient to reach to the hospital. So is stroke treatable? Yes, definitely stroke is reversible. If the patient reaches to the hospital in time, within 4.5 hours, we can give clot buster medications. It is also called as thrombolysis, which can dissolve the clot and the stroke can be reversed. Similar way, there are indications in which we cannot give the medications, or the patient reaches within 6 hours of onset of symptoms. This can be reversed by doing a mechanical thrombectomy. It is an endovascular procedure where we take the stent, retrieve the clot and restore the blood flow to the brain. This is called as mechanical thrombectomy. This usually in normal circumstances can be done within 6 hours, and very rare instances it can be also done in less than 24 hours of onset of the stroke. So remember, whenever there is a patient who has all the symptoms which we described earlier, they should rush immediately to the hospital. So as a general person, what you need to do is identify centers which are stroke ready hospital. Like in People Tree Hospital, we are stroke ready hospital. We have dedicated neuroradiology department where immediately once the patient reaches to the emergency, immediately patient is shifted for the MRI for a stroke protocol. At the same time, the stroke team is alerted, and the neuroradiologist, intervention neurosurgeon, and also the stroke neurologist are aware about the patient, and immediately the patient, once the MRI is done, if the patient reaches within the window period for thrombolysis, the thrombolysis is started, and once we identify there is a large vessel occlusion, immediately shifted to the cath lab. By doing a procedure in time, the stroke can be reversed and we can prevent long-term morbidity and mortality in many of the patients. So we at People Tree are basically stroke-ready hospital. The main requirement for any stroke-ready hospital is we have a dedicated emergency stroke team. We have a dedicated latest technology MRI with cath lab facilities available at People Tree. Thank you.